Greetings, friends and followers. This is Nurses Talking, and I am Dale Barcy. And as always, if you like what you see and hear, subscribe, leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I have the very great pleasure of welcoming Ghecora Boyd out of Pennsylvania, USA. Ghecora is a care transition nurse navigator. She's an entrepreneur. She's the founder and CEO of the Public Health Nurse Collaborative LLC. And in 2025, she won the award. She was an award winner for 40 Under 40, the Nurse Magazine award winner. And she's a DNP student. So, welcome, Ghecora.
Thank you. Thank you so much for having me, Dale. I'm so excited to be here today.
My pleasure, my pleasure. But what my first question always is the same. What brought you to nursing? What's your why?
My why comes from a lot of different places, but I will definitely say that one of my biggest inspiration is from my grandparents. Three of my grandparents were nurses. So I've always had that inspiration to enter the field. I'm a second career nurse, so I started in public health and pivoted into nursing, but they've always been an inspiration to me. My love for science and just really being impacted by them really sparked my journey to join nursing.
Awesome, awesome, awesome. And you said three of your grandparents, which means one was a grandfather.
Yes.
And I look back now, I mean, it wasn't not an easy time for him, um, back then.
Yeah,
So
yeah. And he's so inspiring and he'll probably blush because I'm talking about him. But my grandfather, my father's father, was a nurse anesthetist. And for many years he just said, "Oh, I'm a nurse, I'm a nurse." But I said that's, important history, being
yes,
inspired. And I feel like that nursing spirit and inspiration runs through my veins. And, with my grandmothers, they have been very pivotal in my nursing journey and inspired me even through nursing school. So it's rewarding to be able to continue that legacy. And maybe I'll pass that on to my kids one day or other relatives or family members. But they've always been that big inspiration for me.
that is awesome. That is awesome. You had these three role models. I mean, some people have one. You had these three very close role models and you followed them. But what challenged you when you got into nursing? Was it then what you thought you saw in them?
Yeah, that's a good question. I think one of the biggest challenges in my nursing journey was juggling, doing all the things. So I worked full time, was a mom, wife, and everything else. And so I knew that the journey wouldn't be easy entering into nursing school. But I was so inspired by colleagues, inspired by my patient engagement groups that I worked with at the time. And they actually gave me that final push to actually put in the application and move forward with it. Just because I feel like I'm in a season of wanting to build my legacy and thinking about what kind of impact I want to have in the healthcare space. My entire career has pretty much been in the healthcare realm, but I've always wanted to have that clinical impact on patients that I serve. So I think the biggest struggle was really just juggling everything, but noticing that as I juggled all those different things I was handling, I was also inspiring others to do the same.
Awesome, awesome, awesome. I love it. I love it. I love this inspiration thing going on here today. What,
Yeah.
what kind of areas did you work though, or have you worked? Because I know public health is close to your heart. I can see that. But what kind of areas have you worked?
Yeah, so I started my nursing journey in hematology oncology. Prior to my nursing career, I worked heavily in radiation oncology,
Ah,
and the cancer patient population was really what inspired me to pursue nursing. I had a close relationship with building programs, working with survivors, and really seeing people's journey through treatment and thereafter, what life looks like after. And it actually was my last, I guess you can say the last stepping stone into really pursuing applying to nursing school at the time was them asking me where do I see myself the next 5 to 10 years. So we would have different roundtable discussions, and it was an informal engagement group. But we really allowed each other to share ideas, share experiences, and they pretty much turned the tables back on me and said, "Well, what about you, Ghecora? Where do you see yourself?" And I had mentioned, I said, I've been thinking about going to nursing school, but, I had all these reasons or excuses why maybe it's not a good time or, other competing priorities. And, they said, well, the same time is going to pass whether you do it or not. And,
There
we
you go.
support you. And so I think that was one of the, times where I said, you know what, I'm gonna do it. I feel like I have the support. Um, and just knowing what that's going to take, I really felt inspired to really pursue it.
That sounds good. And that is such a big, that sounds like a routine kind of cliche thing to say the same time is going to pass. But it really is a big thing because we really sometimes have to absorb that knowledge and that realization that whether you do what you want to do or not, time is going to go by. And then what?
Right.
Then what?
Yeah, after oncology, I transitioned into primary care, which is what my passion. And being able to work in a population health space now allows me to bring all of my expertise together. So I feel like I'm really in a good space where I'm able to incorporate my public health expertise, and really champion my nursing career as well.
So you're a care transition nurse navigator. What's that?
Good question. So, primarily, I follow patients who are identified as high risk with chronic diseases. So, I help patients that transition from hospital to home or hospital to skilled nursing facility to make sure that they have everything they need. That can be
Mhm,
from med reconciliation. One of the big things we work with is addressing their SDOH barriers. So, if there's limited access to care, transportation limitations, not being able to afford medications, and then also tying in the nursing education piece. So, if a patient is newly diagnosed, helping them understand the disease, helping them create a care plan that allows them to take this on and build them with self-efficacy. One of my big components of my career with having a patient experience background is really advocating for patients and also inspiring them to advocate for themselves. So
yeah.
when they have questions, I challenge them, or I should say, champion them to ask their primary care doctor questions about medications. That they need reinforced. Ask them about resources that are available to them so that they can be their best selves. Most
Mhm.
patients that I work with, work just like us and are trying to navigate this new normal. Sometimes it's a new normal where things are changing and they really need that support. So I'm proud to be able to be in a space where I'm able to partner with them in their care as they move through their journey.
Awesome, 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 awesome. That is huge because as you just said, you mentioned twice, you just said new normal. And that's a big thing. That's a big thing. Many of us don't actually realize sometimes that sometimes things that seem routine to us actually have changed someone's life, and now they have to get used to living in this particular realization, whatever it is. So that's
Yes,
cool.
exactly.
That's cool. You've been in nursing now. It's a second career. What do you think you'd like to see change about nursing, if anything?
Ooh, that's a good one. Probably a favorite question of mine. I would say, um, the ability to have a multitude of opportunities. I feel like nursing is definitely a field and specialty where there's a lot of opportunities already, but having that access. So for
Mhm.
someone like me who started in public health and biology, and transitioned into nursing, I saw immediately the opportunities I was interested in, but I had to navigate and find those opportunities sometimes in silos. Um, because there's limited spaces where there's some areas where nurses try to transcend into, um, sometimes they're closed off due to, I would say maybe lack of mentorship or
Mhm.
spaces where it's not traditional or perceived
Yeah,
as a traditional nurse
yeah,
space.
yeah.
Um, I'll use policy for example. I've oftentimes in former roles sat in meetings where there's representation and there may not
Mhm.
be nursing representation, but we're
Yeah.
implementing workflows that impact
Back
the
nursing.
nursing
Hmm.
workflow or operations. And so um, I think that's something I would like to see is the doors open even wider for opportunities where our voice matters.
Yeah. Yeah. Absolutely, absolutely. And I'm glad you said that sometimes we're in spaces we are, things are being designed for us that, impact us and we're not there. We're not there. We're not in the foundation. And then
Right.
again, also there's so many places that nurses are that many nurses don't even realize we can be. And that's one of the goals of this channel, actually, is that I really want nurses to see what nurses are doing everywhere. And we're doing so many things in so
Yes.
many ways. We're doing so many things. So you created the Public Health Nurse Collaborative. First of all, why?
Yeah, so my biggest inspiration to create the Public Health Nurse Collaborative was um, to have a space where I can combine all my expertise. I feel like I'm a professional that has a wide variety of experiences. I worked in quality, regulatory, patient
Mhm,
experience, patient engagement, advocacy, nursing, in different fields like oncology and primary care and population health. And I wanted to be able to, one, combine all my skill sets in one place. To offer
mhm,
consultant services, but also be able to inspire those who are maybe looking to take a similar path. I've been approached by many public health professionals and nursing professionals who are interested in making the pivot in one way or another. So I've had nurses say, "Hey, I'm looking to move into more of the population health space or public health
mhm,
space, and I'm trying
mhm,
to figure out, how can I maneuver into that space? What skill sets do I need? What certifications do I need?" And I've also had public health professionals say, I want to go back to school for nursing, but I don't know if I can do it. I don't know if it's going to be too challenging. Um, have experience in these areas. How do I translate that to be
mhm.
a good candidate for my application? And so, with that buildup of a lot of inquiries, I said, I need to really be able to put this together,
Yeah.
to be able to inspire those who are looking to do similar things. And that was one of my main factors in that.
I love it. I love it. And Ghecora, I don't even know if I can proceed any further without noting and applauding the fact how many times in this short conversation you've used the word inspire. I just love it. I love it.
Thank you. Thank you.
I love it. So as you look ahead though, when I look back, I see that nursing has had so many changes and some of them so quickly in the last 10, 20 years. When you look ahead, let's say another 10 years, what do you think you see?
I feel like I would definitely see more diversity in the leadership space. I think that's something that is heavily impacted, so that there's representation for the communities we serve, that's seen from top to bottom.
Yeah.
Um, I also see again more diversity and specialization. So areas where we traditionally may not see nurse and voice, that we have
Hmm.
that representation. So whether that be in policy, legal, in those avenues.
Yeah. I see nurses just, I like it a lot. I see nurses stepping into things and say, listen, we are here. Take it or leave it, but we're here. So here we go. You had three role models in nursing. I'm sure they told you stuff, they gave you advice, but what advice would you give to someone who wants to get into nursing?
Yes, I would say, don't doubt yourself. The road might not be easy, but if you really want to do this career, if you really want to champion for patients and be a true advocate, and learn clinical expertise, to go for it. Don't feel discouraged. Um, have mentors, have people with common goals and interests that you can share the journey with, and to just know that you're not alone.
Yeah. And you really need those people with common goals because that's one of the things, I don't know if it's a downside, but it's one of the things about nursing is that really, unless it's another nurse, they don't always, people care and they want to support and they do,
Right.
but they don't always get it.
Yes. No,
And
that's so
sometimes,
true.
sometimes with other nurses, you don't even have to say it for them to get it. But
No, that's so
So,
true. Because I remember when I decided that I was going back, people thought I was crazy. Like, why? You have a master's degree in public health, you have certifications. Like, I don't understand. You're crazy. And then COVID hit and it's like people were going the other direction, and here I am going in, and I'm like, no stopping me. It almost even confirmed for me the decision I made, especially being a
yeah,
public health professional and going
yeah,
into a pandemic where people don't understand
yeah.
what's happening. There's fear, there's,
Mhm.
lack of understanding. And so being able to bridge that expertise between the two, I feel like made me a real champion in that
Yeah,
time period.
yeah, exactly, exactly. You're, as I said just a while ago, though, you're a founder, you're an entrepreneur. But what would you say is the most important thing you learned in your entrepreneurial journey? Because you have so much experience to back you here. So what did you learn as an entrepreneur?
Oh, that's a good question. I think one of the things that I learned is that, and I know I mentioned using inspiration a lot,
Go
but I
ahead.
think, but I think one of the things I've learned on this journey is that some impact or influence can come from spaces you may not expect it to. So I've actually built even a more deeper following with people outside of nursing and public health, people who are like, I'm inspired and influenced by what you're doing in these spaces. I'm a social worker. Like, I want to do something with you. I want to
Yeah,
be able to
yeah,
partner. And that's one of the reasons why I named it the Public Health Nurse Collaborative, is because, outside of public health and nursing fields, there's so many other areas that are part of the process, especially when we
yeah,
talk about patient experience.
yeah.
There's social work, there's therapy, there's so many different
Mhm.
areas, and um, they all can't be forgotten because it's really an interdisciplinary approach. So I really pride myself on being able to um, work with and be an influence with other areas of expertise as well.
Mhm. Mhm. That's cool. That's big. That's big. That's big. And we talk also about every time I look on LinkedIn, we're all talking about being tired, being burnt out, um, not being understood, all of those things. And so we're talking about self-care, which for me is a big thing. I have to tell you because, it was a long time before I even entertained the thought that self-care was important. Or right, and I
Right.
know that if I as a young nurse, as a student nurse, as a young nurse in my early days, had I even thought or mentioned self-care, someone would have looked at me and wondered, are you out of your mind? Then you're not in the right profession. If you're thinking about looking after yourself, you're not in the right space.
Right.
Which is actually the exact opposite of what it should be. So I want to know, what does self-care mean to you, and what do you do to take care of you?
Well, so one of the things I love to do, I love reading. I like taking quiet time, as I call it. A place in time where I can just pause and reflect. I feel like, being always on the go, life being so fast paced, I think it's like crucial and essential, to be able to just take time to sometimes just do nothing, relax. I
Yeah,
think just being still. So I think that's one of my ways of self-care. And I think that also helps recharge to be able to do the things that matter most to me. Like being there for my family and friends, and being the best nurse that I can be, being the best public health champion that I can be, being the best patient advocate that I can be, is allowing myself to sometimes take a pause, reflect, and rejuvenate to be able to move forward.
yeah, yeah, yeah. And you talked about sometimes being still. And I had to kind of smile at that to myself because, that in itself is a learned skill. It's
Yes.
the so this
It's
is
so
just
true.
happen.
It's so true because your mind can wander. Even, I feel like when I do take a breather and pause, phone down, computer
Yeah,
out of sight, your mind still runs. But I think whatever it's running on at the moment should be things that make you feel joy, things that make you feel
yeah,
happy. Um, and I think that's where that pause really comes in. I feel like
yeah,
our brain never really stops, but what we position and think about is what really helps.
Yeah, it doesn't stop. It doesn't stop. And you have to actively, I think, not think about the laundry and think about the music
Yes.
or yes. No, that actually, when I say that, because when I started paying attention, realizing that, you're doing for everybody else, but not for yourself, and you have to stop and pay attention. That was really one of the hardest things for me, I think. Getting my mind to just get off, to get my body to stop, I could put things away, but getting my mind to stop being in that space.
Yes.
Um, was work. I have to tell you. Ghecora, thank you so much for this conversation. Really, it's been fun and it's been enlightening. And I love, don't ever stop saying inspire. So that,
Thank you. Thank you.
any last words you'd like to leave us with?
No, I just want to thank you so much, Dale, for having me on. This was so much fun. I would love to do it again. It was amazing, amazing. So I appreciate you so much for inviting me on your platform, and thank you so much.
Thank you for coming. Have a good one.
You too. Thank you.